Good morning, everyone. Thank you for coming. My name is Bonnie Shope, and I'm a veterinary dentist practicing in Massachusetts. I'm here to introduce you all to a novel piece of equipment called the Vet-Tome, with the idea of hoping to help you all make extractions easier in your practice. I'd like to get a sense of the audience and find out who here, a show of hands, how many veterinarians are here? Okay. Technicians? And people, managers, people, equipment purchasers for their practices, that kind of thing, one in the back, that's great. Okay. The Vet-Tome's not that new anymore. I've had the Vet-Tome for about 2 years in my practice. But when it first came out, it was completely novel. There was very little instruction available for how to use it. But my friends were using it. And if my friends were using it, a few of my friends were using it, I thought, this is something I need to investigate a little bit further. I made some calls. And across the board, my friends that were using it were saying, yeah, this is a good piece of equipment. It helps me out in jams, and it's really making some of those challenging extractions easier. And I'm glad I bought it. So what I'd like to cover today is helping you determine when it's appropriate to use this piece of equipment, tell you what pitfalls I've experienced using it, what things I love about it, what things we don't quite know yet about it, and just show you some videos of how to set up the equipment, a video of it in use, and of course answer any questions that you might have. The manufacturer of this equipment, or the distributor, IM3, is here at the meeting. Holly is in the back of the room. She's their sales manager, and they do have a booth here if you want to touch and feel and check out the Vet-Tome in person today. You can as well. So what is a Vet-Tome? It's a periotome. It's a mechanical periotome. And it's mechanical, it's driven by electricity, it has a foot pedal, and it has a little tip on the end, and it acts like a jackhammer to help sever the periodontal ligament around the root of the tooth. The Vet-Tome is inserted parallel to the tooth root, and it cuts the periodontal ligament as it's gently rocked from side to side into the sulcus. And you have to work the tip of the instrument around the root of the tooth. So what's different about this equipment is that it doesn't require you to do significant bone removal. There are times where you still need to do some bone removal, but it really minimizes the trauma to the tissues. There are times where you can extract teeth without even doing a periodontal flap or a mucoperiosteal flap. A lot of times our extractions are made much easier because of bone loss from periodontal disease. But we all can think of cases where we have to extract a fractured mandibular canine, for example, and it's a hefty dog, 70-pound dog, tons of bone, no bone loss from periodontal disease. And the Vet-Tome is a great tool for use in those situations. So it comes with 2 different tips. One is called the V1, the other is the V2. The V2 is a thicker tip, it's less flexible, and the V1 is a lot more flexible. And I tend to mostly just use the V1 tip in my extractions. The manufacturer, in their initial recommendations, suggest that you use the heavy-duty tip first into the sulcus to get your extraction started, and then progress to using the thinner, more flexible blade. So it depends on the case. If it's a large dog, I will use the heavy-duty blade first, and then move over to the more flexible blade. But if it's a cat or a small dog, I will just start with the V2. So these blades are really flexible, and it's amazing the first time you use it, and the blade starts to advance down the periodontal ligament space. You're rocking the blade as you go, but it really starts to advance, and it almost feels like it's pulling the tip down along the root. And then when you do pull the tip out and look at it, it will have flexed and into the curvature shape of the tooth. And that's pretty wild and something you have to get used to. It's not like you've just broken your tip or damaged your tip. That's how it's intended to be flexible and guide down along the periodontal ligament space. So I tend to start by using the tip all the way around the outside of the tooth root. And I tend to, like in a large dog, advance the tip maybe 4 or 5 millimeters at a time and working all the way around. And then I make a second pass going another, say 3 or 4 millimeters all the way around. After I've done that and I feel like I've advanced as far as I can, then I'll pull out a hand instrument, a luxator or an elevator, and then gently finish the extraction using that instrument. But by that point in time, hopefully it's easy. You know, you're just popping it out. The tips themselves should be replaced periodically. I tend to, the manufacturer suggests replacing the tip after 10 uses. I just use them until they break. Like most good veterinarians, right? Use something till it breaks. So, maybe that's partly because I'm not in the habit of keeping track, like I've used this 10 times. But if, you know, that's something that you can decide on your own as you get used to using this equipment. The tips can get pretty mangled looking or gnarled looking, and you can straighten them back out again, and I do. Eventually, though, if they're really kind of mangled looking, then yes, I dispose of the tip and put a fresh one on. The tips are not that expensive. They, they come in a pack of 5, and I think the cost is $120, something like that. So, you know, they're not inexpensive, but they're also not significantly expensive. If the tip breaks in the middle of an extraction, don't worry, that's not the end of the world. At first you're like, you know, oh no, like what have I done? Where's this, you know, how am I going to get this tip out? Because you don't even see it if it's down in the sulcus or, you know, in the periodontal ligament space. But just trust that when you do extract the tooth, the tip will be sitting right there and you can just grasp it. I've never lost a tip. The tip is really designed just to cut the periodontal ligament. It's not designed to cut bone. And you will hear the difference if your tip is running into bone. It has a much higher pitch to it, and you can feel the difference too. It doesn't feel like you're cutting. It feels like you're running into a wall. And so if that's happening, you need to redirect the angle of the tip and try to feel that you're, and hear that you're in the periodontal ligament space. So this is the front of the machine. It shows that in this case the power setting is at 6. It goes up to 10. Manufacturer recommends 2 for cats and small dogs. I tend to use about 4 for cats and small dogs and 7 for large dogs. And I've never seen any harm from using it at the higher levels. I'm just still following, to some extent, the manufacturer's recommendations and figuring it out. But I would challenge you to experiment with the different settings and see what works most efficiently in your hands. This shows a picture of a traditional flap in a dog. You can see it's a large flap. There's tremendous bone removal being done to remove this canine. And you know, that's normal. That's what we teach. This is how we've always done it. But the cool thing about the Vet-Tome is you can potentially extract this very tooth without a flap and without any bone removal at all. So when I think about using the Vet-Tome, I don't think about it as absolutely replacing the traditional techniques that we've all learned to do when we extract teeth, but I think about it as something to add to your toolbox, one more piece of equipment to add to your armamentarium for specific cases. I'd also encourage you, though, if you do purchase this equipment, to plug it in and have it chairside every day when you're doing extractions, because if you don't, you may not use it. You know, it's just going to sit on your shelf. You may be less likely, less inclined to be motivated to pull it out once you've already gotten started with your case. So at least in the beginning, until you really understand the value of this equipment, I would encourage you to just, you know, set it up as if you might be using it that day. In our practice, we have multiple veterinarians doing dentistry at one time. And my associate hadn't really gotten interested in using the Vet-Tome. I kept telling her, like, you're really missing the boat here. You need to try this equipment. And you know, I kind of forced it on her. And now she's like, who's using the Vet-Tome? I need the Vet-Tome. So we purchased a second Vet-Tome a few months back because it's really something that we're both enjoying using. We don't use it on every case, but we like to have it when we need it. So pick your tooth. Today I'm going to try to help you determine when it's appropriate to use the Vet-Tome. This is an example of a young dog with a fractured canine. The canine was fractured at the gum line. This dog weighed about 30 pounds and was owned by my technician. And I was able to extract the canine tooth from start to finish in 12 minutes. Start to finish, including suturing. Yeah, I was pretty impressed with the situation. It made me very happy. So what you can see is that this canine tooth has a healthy periodontal ligament space. And that's necessary for the Vet-Tome to work. If you have tooth resorption with root ankylosis, the Vet-Tome doesn't work. I have used it in certain cases where there's some resorption on one side of a tooth and not the other. So I've used it in the periodontal ligament space where the root doesn't have resorption, but in general, it does not cut bone. So it won't be successful where there's resorption. It's also really great for cat mandibular canine teeth and for small breed dogs that have severe periodontal disease and you need to extract the mandibular canine teeth and you're worried about jaw fractures. And I have a slide of that. So here's my technician's dog before and after, and you can see that there's no flap. I don't want to tell you that you never need to do a flap. It is always important to close your extraction sites, and you want to close those without tension. And so in this case, I was able to still undermine the flap. There was no flap. I was able to underline the mucoperiosteum without creating a flap so that I could release tension. So I was able to sort of lift it off of the bone and put some iris scissors in underneath the flap so that I could release tension and still get it closed. But still, from start to finish, 12 minutes. And I'm accenting how it's a faster procedure, but also think about healing and postoperative pain, discomfort, swelling. That's all going to be minimized when you do less tissue trauma. You're less likely to have a dehiscence, and even if you did have a dehiscence, it would probably easily granulate in if you haven't done a flap. Yeah. I can't, it's interesting with this screen, you can't use your laser pointer. Like, you know how you can, it points really well there, but it doesn't point, I guess if I'm really close, I can get a little bit of action. This is, that is bruising from a local block, an infraorbital block, some hemorrhage. This is a large breed dog, 70-pound dog with a fractured mandibular canine. I will always use the VetTome for these cases now. It is absolutely, it saves on my physical exertion, saves on my hand fatigue, and sometimes I will still do bone removal. I would still certainly do a flap in these cases to close this defect, but yeah, this is a great example where I'd first use the heavy-duty blade, and then I would switch over to the lighter blade. And here's an example of a small breed dog, terrier poodle-y looking thing. And you can appreciate that there's significant bone loss in this area. And yet there's still significant bony attachment as well. So the tooth needs to be extracted, but these are the cases that get referred to me for jaw fractures from time to time when people are extracting these teeth and they put too much force on the extraction, and we'll see a fracture, often right in this area, or potentially back here, but more likely up here. So the beauty of the VetTome in this situation is that it's just going to follow this periodontal ligament around here and here, and obviously 360 degrees around the root of that tooth. And so it's not putting any force on the bone to potentially trigger a fracture. Yes, you still need to elevate or luxate at the very end of after you've used your VetTome. But at that point, you know, it's a very steady, mild pressure. You're still appreciating the fact that you can still break the jaw. So you shouldn't have to apply as much force. So for me, this is also a case where I will always pull out the VetTome. Switching gears, this patient had stomatitis or cups and had to have full mouth extractions. And these teeth are definitely have tremendous bone support, very little periodontal disease in this case. I did stage this case. I worked on one side one day and then saw him back maybe a month later to finish the extractions on the second side. But I still knew that this was going to be a big case for me and that I was going to be tired at the end of the day. So I thought, I'm going to try the VetTome on this case. And I ended up using it on every tooth in the dog's mouth. You can see the x-ray, a post-op x-ray. You can see, you know, all these clean alveolus, very little bone removal was done to get these teeth out. And it went really well. I was very happy that I had it in my toolbox that day. Here's a lower molar, a mandibular first molar in a dog. Once again, this is a fractured tooth that needed to be extracted. It didn't have any naturally occurring bone loss from periodontal disease. And you know, if you look carefully, you can see I did a little bit of bone removal here and here. But the rest of it was just using the VetTome to incise the periodontal ligament. It hadn't occurred to me that I could use this in baby teeth until I talked to another friend of mine who said, have you tried it in deciduous teeth yet? And I think I was afraid to try it in baby teeth because we really worry about the risk of damaging the developing tooth bud when we're extracting deciduous canines. This puppy here had a malocclusion. The lower canine was traumatizing the palate, and that tooth needed to be extracted. You can see on this radiograph how long the root is and how healthy the root is. It's not a resorbing root at this stage. And here's the developing tooth bud that we need to protect. So the VetTome is a nice piece of equipment for baby teeth as well. I would radiograph, always recommend a radiograph first. And still, I would just use the fine tip, and I would be gentle, recognizing that babies have almost soft mandibular bone. It's not that dense. But it will really simplify your extractions and hopefully put you in a position to do less trauma, potentially, to the developing tooth bud. Cats. Even I don't like to extract mandibular canine teeth in cats. They're hard. They're really, really hard. And it's a happy day when we have such severe root resorption that we can do a crown amputation and leave that root behind. That makes it so much easier. But this tooth in this cat also needed to be extracted. I can't remember why, but I did extract it, and the VetTome, this is a great opportunity once again for the VetTome, cat mandibular canine teeth, but only when there's an intact periodontal ligament. Once again, can't be used when there's root resorption. This is a slide showing root resorption. There's various types of root resorption, various radiographic appearances, but certainly here you can see that there is no periodontal ligament. This root is being replaced by bone. Same with this one here. And certainly same in here. You can see it almost looks like a notch out of this tooth. So these are situations where the VetTome is not going to be useful. In terms of technique, when you're using the VetTome, the manufacturer recommends using 10-second intervals, 10 seconds on, 10 seconds off, 10 seconds on, 10 seconds off. And by taking 10 seconds off, this allows the handpiece to cool off and not become overheated. The other thing to know about this instrument is that it's noisy. It sounds like a jackhammer, and it really does seem like a jackhammer. So initially, when you use this piece of equipment, you're going to use a scalpel blade to incise the epithelial attachment around the tooth. And then you're going to approach the tooth at a 45-degree angle with your tip. You're going to activate the foot pedal, and it's going to start to make a noise and vibrate. It vibrates. It moves at 20 rotations per second. So it's very quick happening. And what I wanted to show you next is a 3-minute video that shows the beginning of sort of demonstrating how to set up the equipment and how to use it.
The IM3 VetTome is an automated veterinary-specific periotome unit. The action of the stainless steel tips cutting the periodontal ligaments results in less trauma and minimal alveolar bone loss. Let's go over initial setup and operation. The VetTome system consists of the following components: VetTome control unit, handpiece cable, handpiece holder, handpiece, solenoid, chuck release tool, 2 standard flat tips, 2 heavy tips, foot switch, mains power cord. Now, let's set up the unit. On the rear of the control unit, plug the power cord into the socket. Plug the foot switch cable into the foot switch connector. On the front of the control unit, plug one end of the handpiece cable into the handpiece cable connector, then plug the other end of the cable into the bottom of the solenoid, making sure to line up the red dots on the handpiece and the handpiece cable. Insert the solenoid fully into the bottom of the handpiece, turn the solenoid clockwise, then release. To install a tip, insert the chuck release tool into the slot in the chuck assembly, the body of the handpiece. Insert the tip into the top of the chuck. Remove the chuck release tool, then tug gently on the tip to make sure it is installed properly. When installing and removing tips, don't try to rotate or unscrew the chuck assembly with the release tool. You are now ready to power on the device. On the rear of the Vet-Tome, turn on the mains power switch to the on position. Press the standby button on the face of the unit. After a short self-test, the unit is ready to be used. The initial intensity or power level is 1. This can be adjusted up to a maximum of 10 by pressing the increase intensity up arrow button. The decrease intensity down arrow button reduces the intensity level. The Vet-Tome is now ready for use. Stepping on the pedal activates the solenoid, which then transfers impact energy 20 times per second through the handpiece to the tip. Here is an example of side-to-side tip technique. The recommended duty cycle in operation is 10 seconds on, then 10 seconds off. Exceeding this duty cycle or operating the handpiece continuously may cause heat buildup and loss of performance. After use, the handpiece may be autoclaved, but be sure to remove the solenoid from the handpiece first. The solenoid cannot be autoclaved.
All right, so I think that video is useful, particularly for hearing the noise that it makes, but also just showing you how to get it started. Yeah, question? No, I don't. I mean, maybe the first few times you use it, you could to kind of train yourself and get a sense of how it feels. I've never detected that the instrument felt overheated in my hands. So I may go as far as to say that I don't stop all that much and take a break. But I am mindful of the manufacturer's recommendation and think about it as I'm using it. I like to say I use a hybrid technique. There's a lot of times where I'm still doing some bone removal and a flap for these cases, like for example, a mandibular canine tooth. Sometimes also another strategy for extracting a mandibular canine tooth is to cut the crown off to the level of the gingival margin, and that can make it easier to get the tip of your Vet-Tome down around 360 degrees around the canine tooth. And certainly you want to avoid damaging the third incisor next to the mandibular canine tooth. The handpiece tips and the handpiece itself can be put in an ultrasonic cleaner and can be autoclaved. The only thing that can't be autoclaved is the solenoid. Who knows what a solenoid is? I had to look it up because somebody here knows what it is. First of all, it transfers the impact energy through the tip 20 times per second. And the solenoid, it's a cylindrical wire, and as the electrons flow through the wire, it acts as a magnet while carrying this electric current, and it converts electrical energy to mechanical energy. Question? No, it doesn't fall out on its own. So you're severing the majority of the periodontal ligament, but there's still some attachment. So once you feel that you've gone as far as you can around the root surface with the Vet-Tome, then you're going to use either a luxator or an elevator, your preference, to finish removing it from the alveolus, and then you'll grasp it with extraction forceps and pull it out. I do have a video, one more video of one of my colleagues extracting a tooth, and you'll see it in that video as well. This slide just shows the chuck being used to change the tip. It's important when you're holding the handpiece not to inadvertently damage the connection here, because people have the tendency to hold the handpiece against their body when using the chuck to kind of leverage the tip out. And it's just important to be cognizant that you don't want to fatigue that. The manufacturer told me that they've seen people break their handpiece in that area. And so I just want to educate you all that it's not because I don't think it's because it's like a poorly made connection. It's just it's not designed to be bent in that area. All right, so this video is 6.5 minutes, and it does show extraction of a canine tooth.
Bonnie is a healthy 12-year-old female spayed Queensland Heeler cross. As with any dental case, a complete oral health assessment and treatment is performed, including periodontal probing, dental radiographs, and dental charting and treatment of any identified pathology. The tooth extraction is performed by Dr. Anthony Kaifa of North Coast Veterinary Specialists and Referral Center on the Sunshine Coast in Queensland, Australia. The length of the procedure from incision to closure of the extraction site is 25 minutes. Bonnie needs an extraction because she has a complicated crown fracture on her lower right canine tooth, or tooth number 404, with pulp necrosis. Prior to starting the procedure, a cuffed endotracheal tube is placed and a pharyngeal pack is positioned to protect the oropharynx from any debris. A right side intraoral approach, caudal mandibular nerve block, is then performed. Periodontal probing is performed around the tooth to be extracted to rule out any periodontal pocketing, and a sickle explorer is used to demonstrate the complicated crown fracture. A horizontal intrasulcular releasing incision is made around the tooth to release the gingival attachment to the tooth. The Vet-Tome is introduced at an angle onto the mesial surface of the lower right canine, or tooth number 404, allowing the tip to follow the periodontal ligament parallel to the tooth root. A side-to-side action is used as the Vet-Tome blade tracks along the periodontal ligament. It is imperative that the operator support the jaw while the Vet-Tome is in action. The Vet-Tome is operated by a foot control and should not be used for longer than 10 seconds at a time. The Vet-Tome's foot pedal is then released and the blade withdrawn with the same side-to-side action. The Vet-Tome blade can now be reintroduced onto another surface of the tooth, eventually working around the circumference of the tooth. The fine Vet-Tome blade is flexible, so it can follow the curvature of the root. The Vet-Tome can be used on all surfaces of the tooth with safety. This is an advantage when compared to traditional dental elevators that can slip when used on the vestibular or buccal surface of the tooth, with the possibility of causing iatrogenic damage to the patient or the operator. The operator can place the blade back into the areas already luxated and thus get further along the root. If there is resistance to this, the blade can be changed to the fine blade to allow for further advancements along the tooth root. An IM3 winged elevator is now introduced at various insertion points into the spaces created by the Vet-Tome. Please note that there has been no vestibular flap raised nor vestibular bone removed to assist in the extraction of the mandibular canine. An assessment of the tooth's mobility is now made, and a decision as to whether further elevation is required or it is now appropriate to apply extraction forceps to the tooth. The extraction forceps are applied as far apically along the root of the tooth as possible, which minimizes the chance of root fracture. Canine teeth tend to be more oval in cross-section as compared to premolar teeth. Thus, the extraction forceps are used to move the tooth in a mesial or rostral direction and then to hold the tooth for a period, allowing any remaining periodontal ligament fibers to tear. A force is then applied in a distal or caudal direction, with the same desire of tearing periodontal ligament fibers. It is imperative that the jaw be supported with the operator's other hand during these movements. When the tooth has been delivered from the alveolus, an inspection of the tooth is performed to look for any root fractures or any other pathology associated with the tooth. The end or the apex of the tooth is then inspected for any soft tissue pathology that may be attached to it. A postoperative radiograph is taken to confirm complete removal of the tooth with no iatrogenic damage to surrounding bony structures or neighboring teeth. A bone curette is then used to debride any soft tissue or other debris from the alveolus or socket. Sterile saline is then used to flush out any debris from the alveolus. An inspection of the bony walls of the alveolus is performed prior to suturing of the alveolus with 4-aught absorbable suture. It is imperative that a stable blood clot forms within the alveolus to allow the healing process to begin. Written client instructions on diet, oral hygiene advice, wound, and pain management should be given on the patient's discharge from the practice. It is also advisable that the extraction site be re-inspected at a subsequent review appointment. To quote Dr. Anthony Kaifa, "The IM3 Vet-Tome offers a paradigm shift in the way we, as veterinarians, extract teeth in our patients. It is certainly less invasive than traditional surgical extraction techniques. Complications such as jaw fracture, damage to neighboring teeth, or soft tissue will be minimized when the Vet-Tome is used correctly. In my opinion, the IM3 Vet-Tome offers a game-changing approach to tooth extractions in our companion animals."
So one thing that you could see in the video was that it seems like the tip sometimes gets stuck. How about that? The tip of the blade does kind of get stuck in the periodontal ligament space, and you're just supposed to gently rock it back and forth in the same motion that you used to insert the blade down into the sulcus. So there are times where I struggle to pull it out, and so because of that, I have learned to not necessarily advance it so far on my first pass. I prefer to maybe only advance it like halfway. Even though it wants to keep going, I realize it might be harder to pull out. So that's just the kind of thing that you just have to practice with the equipment and kind of get a feel for how it works. Just like anything we learn to do, the more we practice, the better we get at it. But I think it's obviously has its uses in veterinary dentistry for sure, and I'm very glad I have it. So glad that, as I already said, we bought a second one. So do you have any questions? Thank you.